The occurrence of uterine fibroids is the result of a combination of many factors. A single factor will not cause the appearance of uterine fibroids. On the basis of an individual's genetic susceptibility, environmental harmful factors act on the body and then combine with certain internal and external factors to induce its onset. At present, the cause of uterine fibroids is not clear, but after statistical analysis of a large number of clinical case data, get the relevant factors that affect the pathogenesis of uterine fibroids. These factors increase the risk of women suffering from uterine fibroids. Since the factors included in the statistics can only be subjectively considered, that there may be influencing factors that may increase the risk of uterine fibroids. The undiscovered related factors will not be considered for the time being. According to research findings, it was found that patients with uterine fibroids, compared with normal healthy women, age, occupational stress, dysmenorrhea, BMI, history of marriage, history of miscarriage, history of gynecology, use of hormones and steroids, and history of genetic disease all showed significant differences. It is preliminarily judged that the above factors may be one of the reasons leading to the onset of uterine fibroids. Further statistical analysis of multiple factors found that older age, a history of miscarriage, a history of gynecology, frequent use of hormones and steroids, and a history of genetic disease are the main risk factors for uterine fibroids. According to research findings, preliminarily judged by comparison, that cervical erosion, pelvic inflammatory disease, adnexitis, menstrual disease, family history of gynecological tumors, age at menarche are related to the occurrence of uterine fibroids. After further statistical correction of multiple factors, it is found that the delayed age at menarche can reduce the risk of uterine fibroids. Cervical erosion, pelvic inflammatory disease, adnexitis, menstrual disease, family gynecological tumor history will increase the risk of uterine fibroids. Experts think related factors affecting the onset of uterine fibroids include age, obesity, history of pregnancy and miscarriage, race, smoking, drinking, blood pressure and exercise, genetic and environmental harmful factors. Environmental factors include physical factors such as large doses of radiation exposure, long-term use of computers and mobile phones, and chemical factors such as pesticide residues, food additives, detergents, automobile exhaust, and plastics. In summary, the occurrence of uterine fibroids is the result of a combination of many factors. It does not happen due to a single factor change. On the basis of an individual's genetic susceptibility, environmental harmful factors act on the body and then combine with certain internal and external factors to induce its onset.